Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast.
Good day, everyone. This is your friendly pharmacist, Dr. Keith. Welcome to another podcast episode of Destroying Diabetes. I'm just glad that you've taken a little bit of time out of your day to listen to what I have to say. I don't know. I hope it provides some knowledge and information, is productive and helpful in your life. If not, just send me an email and let me know. And if there's something that you want me to talk about, that you may or find interest for yourself or for you think the public in general, feel free to email me. The email is in the show notes, so you can always contact us there. Like I said, if you have any good ideas as far as topics you'd like for me to cover, if there's somebody you would like to see if I could get onto the podcast, I'm greatly appreciative. And as I usually say, they let me in here again, so they didn't lock the door. So I guess we're doing okay. I guess we got enough people that follow us and listen to us. So they haven't locked the doors yet on me still. So I really appreciate that. Really appreciate. So thankful for the support. The best thing that you can do is let family and friends or anybody you think that can benefit from this podcast. Um, they don't have to be in the area. They don't even have to be in the United States. Anywhere that they have an internet connection, you can listen to this podcast. You can go to apps that have podcasts, such as Apple. You can also go to like Amazon, where you can listen to podcasts. Spotify, it's another place, or generally most of the major streaming platforms for podcasts should be able to get this podcast. So, and just thankful for all the support from them as well. So they have me sounding really good. You don't want to hear like the rough parts before they edit, but they are thankful for people that I work with that make me sound like I halfway know what I'm talking about. So thank you again. And like I said, best thing to do, it's really just word of mouth. Just let people know. If you want to promote us in your social media, that would be good as well. Subscribe to the podcast so you don't miss when we have a new episode coming up, and that you're alerted as well. Rate us, give us a 5-star. If we're not a 5-star, then just let us know what you think we need to do to become a 5-star podcast. So, and you leave any comments, especially in our we're access on YouTube as well, the Destroying Diabetes podcast. So if you want to leave any ratings or reviews on that as well, that's something someone can look at if they are not familiar with any of the streaming apps for podcasts. You can always go to YouTube. And we have some good guests lined up coming in the next few episodes. So just really, really make sure that you subscribe and you get the alerts when a new episode drops, so that you'll be able to be one of the first ones to hear it. And I'm looking forward for you hearing. There's a lot of really good information coming out, and I really encourage you to stick with me, and we'll get that information to you. So be on the lookout for some new fresh episodes. We have some outstanding guests lined up coming aboard. So that also is some vital information for if you or any of your loved ones have to deal with diabetes, particularly type 2 diabetes. So like we do on this show, the purpose of it, it's like I like to give some practical advice, help you manage, or some people maybe overcome diabetes. So, like I said, if you never listened to any of our previous podcasts, I'm not just a pharmacist, I'm a client. I'm the type 2 diabetic for myself. I've been a type 2 diabetic for almost 20 years. So, I'm speaking from experience firsthand. Um, and the topic for today that I'd like to talk about, I actually had the opportunity to attend a very good workshop dealing with men's health at my local church in North Carolina, and it was very informative. We had a very informative guest, and it was a men's only, so that was good. So men could feel free to ask questions without worry about ridicule or embarrassment. So it really worked really well, and it was really some great questions at that conference. So kind of piggybacking off of that, I just decided to spend a few minutes. Um, Anyone's welcome to listen, but I really want to pay particular attention to the men out there. And ladies, if you have a man in your life, they're not listening to this podcast, this might be the one that you want to listen to. Well, we got another one that's really good that's upcoming too. So look out for that. There's some that's really directed toward men. Um, as you know, that we don't do as good of the job of taking care of ourselves as our female counterparts. We don't go to the doctor at the same rate. We don't address medical concerns. We kind of tough it out. If it's a little bit of pain, just tough it out. Don't say anything about it. It's a little discomfort, or if it's something just in your body that's not working like it used to. Um, some of it's just having this tough kind of macho exterior, like just tough it out, just put some dirt on it and keep going. That's what they used to tell us, growing up. If we suffer anything, just swallow it up. But unfortunately, that's not good as far as health, because we can take something that may not be major, but because we don't address it, it becomes major, and then we don't find out about it until something life-threatening may happen, but we don't want to get to a point where you're going into the ER and they have to um, remove a limb, or you've had a heart attack or a stroke, so something like that, or organ failure or something like that. Let's not get to that point. One of the biggest things is that the biggest thing that you can do is just from a young age, just monitor like your body. If something doesn't feel right, or doesn't it's not working as well as it used to, address that with your primary care physician first, and then if it's something beyond their general expertise, they usually can refer you to a specialist if that's needed. So, but the main thing is to let your primary care doctor know, and the sooner you can address it, the better. The more likely that it can be addressed without any kind of major ramifications. But if you put it off and ignore it, then the chances of it becoming something major increases. Well, one of the big things with like diabetes, and why we have to maintain adequate blood sugar control, because as we talked about in previous podcasts, diabetes is triggered and lives off of inflammation, and this inflammation can affect our organs, and it can cause damage to our organs, can cause our organs to work harder than what they usually do, whether it's just like our heart or blood flow to our brain. And if that's disrupted, then that can cause a stroke. If blood flow is disrupted in our heart, it can cause a heart attack.
or they can contribute to a stroke as well, or it can cause all sorts of heart issues like irregular heartbeat, um, just different things. You can have kidney damage. Your kidneys can fail because of the inflammation and the high blood sugar levels damage the kidneys, and you can have problems with your kidney. It can get to the point where you may have to be on dialysis, or you may have to have the kidney removed or have a kidney transplant to make it. So we want to make sure that we have good control of our blood sugar, and that we need to work hand in hand with our doctor. You can work with your doctor, you can work with your pharmacist. There's other people like dietitians that can help as well. Like most places now have access to like a dietitian or a nutritionist now. It's either on staff or it's available to you in most practices. So take advantage of that. If that's something in your practice, if that's something you struggle with, your diet, you struggle with knowing what are the right things to eat and having the right things to eat and ways to avoid some of the things that are not so good for you to eat and finding alternatives, it's really a good idea to talk to a health provider. Like I said, there's plenty of people that can help. Like I said, like you have the nutritionists, nurses, dietitians. Even you can have pharmacists like myself can help as well. And that's one of the things. And also, I have a link in the show notes if that's something that you're interested in. And this goes to anybody, just not men. What I'm offering now through July is a free 10-minute consult. And we'll have the link in the show notes as well. So you can get a 10-minute consult. We can review kind of like your medications, anything that you're taking over the counter, and can begin to see what kind of suggestions can be made to help optimize your health. Maybe some medications that doses may be need adjusted, or maybe you're not having success with a certain medication, and maybe something that we can recommend to your primary care provider to look into. A certain tests that you may or may not have done that we can recommend that you can have done by your primary care provider. So also things that we can talk about, especially with dealing with supplements, the supplements that may help with some of your conditions, or there may be supplements that you're taking that may be worsening your conditions that you may need to discontinue. So that's something that we can sit down, we will get like a 10, 15 minute, and you don't have to be in Durham or the Raleigh-Durham area, North Carolina. We can do it virtually, so you can be anywhere in the world. Basically, you have an internet connection. We can sit down and do this. So they're not limited to here. So if you have a loved one throughout anywhere in the United States or Canada or most countries, if you have an internet connection, we can work with them. So I'm just putting that out there as a resource. That's something that you may not necessarily be comfortable talking to a provider. You may not have a regular provider. Well, we can work with you here, and I can work with you. It would be my honor to work with you if you will let me. So, like I said, if we don't have good blood sugar control, we can have all sorts of issues. And those issues can also extend to sexual health as well. And so you can have problems with erections. You can have problems with like low testosterone levels, and that can be caused to diabetes as well. So, well, having the low testosterone levels, you can have reduced like libido, fatigue, depression, and reduced muscle mass. And it's just it's thought not the exact mechanism is not totally clear, but it's believed that insulin resistance and high blood sugar levels may interfere with the testosterone production. So, if you have those diabetes and it's not controlled, it can affect those issues as well. And then the main important thing, if you do have those issues, is again to get that checked. There's several tests that can be done by your provider to measure like your testosterone and see if it's low. And there's a lot of options available, but probably the best option that's available regardless is just having your blood glucose levels. Again, you're gonna hear me just keep talking about it because that's the number one thing is having blood glucose under control. So you need to make sure that you have a device that you can measure your blood sugar with, like a meter, whether it's um, just a regular meter or maybe one of the new ones, the continuous glucose monitors that you wear for a period of time and it measures your blood sugar ongoing. If you're someone and your insurance covers it, I strongly recommend it. I've had a previous podcast where I talked about continuous blood glucose monitoring, CMG, so you can look it up in past episodes. And if you want to listen to that and get some information about that, that's well. And like I said, I strongly recommend it because just having access to that information all the time, you can notice like trends. You can notice like which foods really drive up like your blood glucose that maybe you need to lessen. And you know what periods of time that you may experience like low blood glucose level, and it might be to due to your medications and what time of day that you're taking them. So it's always a good idea, and your doctor can look at that. That gives your doctor a really great snapshot of what's going on. You can have those readings available for your doctor. The doctor can read them off of the app, and they have a good idea about what's going on about your blood glucose control. Okay, and then the other big thing what we talked about with out of control blood sugar levels. Um, we talked about heart disease. That's a big factor. You're just more likely to develop a heart disease and a higher risk for stroke if your blood sugar is not controlled. Um, and usually, if your blood sugar is not controlled, a lot of times that carries into other areas, like your blood pressure is usually elevated. Usually, your body you may have high cholesterol, and also a lot of times you may have like obesity, but not always. But those things usually correlate all together. And so the best way to maintain good blood glucose control or blood sugar control is, like we talked about eating earlier, eating a healthier diet, more fruits and vegetables, less processed food, less junk food, and then big thing, just as good as a healthy diet. The healthy diet is number one. That's the if you don't do anything else, having a healthy or changes in your diet will do more than anything else. So if you don't do anything else, just trying to get a healthier diet and not eating heavy laden fats in the food, just processed food that just drives your blood sugar up just because they just have a lot of bad things in them. Just that causes that. The second thing you can do most is like physical activity. And notice I didn't say like exercise because physical activity doesn't have to be that you got to run a marathon or you got to lift 200 pounds in the gym. Even though if you want to do that, you can. But physical activity is just like you got to get your body moving. Our bodies are meant to move. Our bodies are structured to move. Before we had all this modern technology, I mean, when we were mostly agricultural society, that wasn't hard because most of that work was very physical. So we had our physical activity in our jobs. I mean, we were moving and carrying, pushing, dragging stuff. So we were getting a lot of our physical activity with our work. And then, of course, the foods were not as bad as it was now. Our foods were more closer to nature. So that was another thing too.
We want to avoid smoking, of course.
It's that aggravates a lot of this health conditions, limit like alcohol consumption as well.
And like I said before, you got to go to those regular checkups, or you need to be seeing your doctor.
At the very minimum, at least once a year. Let them see you like at least once a year. Um, if you have ongoing health conditions like diabetes, you may need to be seen more times a year, maybe every 6 months. If you having some issues, and maybe every 3 months, but that'll be up to you and your provider to decide how often you need to be seen. Another damage that men need to be aware about with not having good control of the blood sugar
Is nerve damage. That's one that's not talked about as much. Nerve damage, if your diabetes is not controlled and you have all that inflammation and
all that blood glucose running around in your veins, it damages your nerves. And the biggest thing where you see that is in your hands and your feet. Usually, most people, if they have damage, most of the time where they experience this in their feet, they usually get some tingling or numbness in that area, in their hands as well. That's usually a sign that your blood glucose is not being controlled and your nerves are being damaged by that.
and you got to get that fixed. Got to get that fixed.
Because you have damage. It may be so much damage. You may have some of your body tissue, blood not getting to that area of the foot, and so you have decay in tissues, and maybe so much that you may have to have that limb removed because there's so much damage and it could spread to the rest of your body. So you really got to your feet are so important, especially if you're diabetic. So you need to examine your feet on a regular basis, preferably like after you get out the shower, especially if you shower like in the evening. It's a good time to look over your feet, see if there's any cracks or sores. If they continue to be that, let your doctor know. The doctor can help you address that. You may have to see a specialist, may have to go see a podiatrist if it's a lot of issues and damage, but you got to take care of that because those sores and calluses and corns, they're indication of that there's something a issue with it, usually with your blood sugar, and that's triggering those things are in response to that. Um, and we talked about earlier with the sexual health that you have nerves in that area and damage well, of course, will affect that, and that you can have erectile dysfunction could be one of the causes of that as well because of the nerve damage. So you really want to gotta take care of that blood sugar, man. It affects everything.
Um, so like I say, biggest thing like with your feet, just make sure that you're wearing comfortable shoes. They're well fitting. Like keep your feet clean and moisturized.
Usually like a good idea is just kind of keep the lotion. There's several lotions that you can get through prescription that help, but a lot of times the over-the-counter ones work, just as well if you don't have a severe issue with dryness or whatever. So
You just want to make sure that that's always looked at. And so the biggest thing that I want everybody to realize is that the biggest thing, man, is that you have to be proactive.
don't want to wait till you're in the hospital, you're in the ER, and the damage, you suffered a heart attack or a stroke or your nerve pain is so thin you can't even stand up and walk. Or again, another thing is your eye health. And like I said, we had a previous podcast dealing with eye health. If you haven't listened, that's a good podcast to download and listen to. Have a lot of good information on there. So I won't really go into that at this time because the same thing, if the damaged nerves to the eyes, you can be a big cause. The number one cause of blindness is diabetes. Number one cause of glaucoma is diabetes. So if you want to avoid these issues, you really need to get your blood glucose under control. And that's the thing I want to emphasize. If anyone gets anything from this podcast, is that really need to get your blood sugars under control. You need to have a way to measure it on a daily basis so that you can keep track of it. If it's not under control, you need to speak with your primary care physician. You can speak to your pharmacist as well. They can maybe have some suggestions. And like I said, someone that's willing to give suggestions, but you have to do it. You have to be proactive, not reactive. Reactive, it can be a lot of damage is already done, and it may not be a lot that can be done if the damage is severe. So you want to really be proactive, and if you have someone in your life that has diabetes, especially male that has diabetes, make sure that they're staying on top of it. Because it is something that's life or death. It's something that can be, controlled, can be even, reversed in some cases if appropriate lifestyle measurements are taken and adhered to. And I just wanted to put this out in the podcast. This information can apply to anybody, but I just really was directing to our men out there. We love you. We need you. We want you to be around for yourself and for your family. So please, if you don't take nothing else from this, just make sure that you get your blood sugar under control. And like again, if you want to or have someone do a free consultation with me, it's in the show notes, and you can make an appointment and we can work on that. If you want some help or if you just want someone to talk to, kind of guide you and give you kind of strength. So thank you again, everyone, for supporting this podcast. Please follow this podcast if you have a friend or someone in your family, especially a male in your life that has type 2 diabetes, and they may not be doing the things necessary to take care of it, or they may not be aware of not taking care of it, what the ramifications are. Please just get this to them, get this episode to them, and let me know how it goes. And again, thanks everyone for tuning in to Destroying Diabetes. And just remember that managing diabetes is a journey, but with the right knowledge and support, you can live a healthy and fulfilling life. Be sure to subscribe to our podcast and join us next time for more tips and expert advice. Until then, stay healthy and be well.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.